Hi, my name is Sam Gibb and my student number is T00698764, and I'm here with my dog Hunter today, and we're going to be showing how we're going to be doing the PROMS motions, and we're going to be talking about some patient care related to the PROMS motions. So first I'm going to get Hunter to roll over onto his side. Roll over. We're going to give him a little snack. Lay down. And then for this, we want to have the patient on their side, and we're going to start moving the toes. Right? We would do this about 10 to 20 times, and we want it to be in a natural position. And then from there, we would do the wrist. Good boy, stay. We would do that 10 to 20 times, and then back the other way, 10 to 20 times. Just like this. And then we would move up to the hip, or the shoulder rather, and you're gonna do that 10 to 20 times. And then back the other way, 10 to 20 times. But this is a demo, so I'm not gonna do this 10 to 20 times. That's a good boy, Hunter. I give him a little snack again, and then I gotta do his back. So it's the same thing, where we would do the toes in both directions. One this way and one the other way. I'm doing the way that our video showed us. And then we do this way. And with the foot, back and forth. And I'm just guiding, I'm not really forcing. 10 to 20 times. And then the other way, you would go 10 to 20 times. Good boy, good Hunter. And then this way, we would do 10 to 20 times with our hips. So moving up, and then the other way. And again, just guiding as if this were to be a natural motion. 10 to 20 times around. And a good boy. What a good boy Hunter is. Good job. So that explains that. And then so next question is, if our patient was in a semi-comatose position, heavily sedated, and has vomiting or regurgitation issues, demonstrate how you would elevate the patient's head while in lateral recumbency using towels. Okay. So lie down, Hunter. Roll over. Good boy. So to do this, I have to prop up underneath the neck. I'm gonna use a smaller towel, like this. And then he would be like this. So the towel is kind of underneath the neck here, but his head is still facing downwards. So if he does regurgitate, or if there is any vomiting, it's basically going down, and we don't have an aspiration issue. That's because we wouldn't want the patient to choke or aspirate. So that way, if we have the neck propped up and then the head's going down, we don't have to worry about aspiration. So next question. This is a patient that does not have a TBI and a lateral, so we explained that. If the patient, this is the patient with a TBI, explain the camera what the angle of elevation should be and why this is important for this patient. What happens if the angle is too severe? So we want the angles to be between 15 to 30%. The reason we want it 15 to 30% is so that we do not have regurgitation type issues. We want the neck to be in a natural position because we don't have the regurgitation issues to be concerned about, but we want the neck to be propped up so that we're not causing damage to the spine and to the joints. But we do want to make sure it's not propped up farther than the 30% because that can have a decrease of cerebral fluid. So that can really decrease the cerebral fluid that's going to be in those areas. So we don't want that to happen. We do want fluid to be in the areas, and we do not want a decrease of it. So that's why the ideal is 15 to 30%. The next question is, demonstrate how you would prop up the patient in sternal recumbency with the hips in either lateral, left, or right position. Use rolled up towels or other materials such as foam wedges. Make sure your patient's airway is open by using Okay. So Hunter, come on. So I roll him into an upward position. Hunter, lie down. No, come on up. Come on up. Okay. Head down. Head down. Right down. So like this, I would have the towel. Hopefully you can see this here. I would have Hunter up. Come on. He's all excited about the treat here. Lie down. So I pull him into more of a down position. And this towel, might need one more for a guy his size, or a larger towel. Down. So you would have a towel underneath here to prop his head up, kind of like this. Ideally in a straight position, especially if it was a sedated patient. And then you would place towels on either side to prop him up. Like this, and then this one over here, come on. So now I have towels on either side of him, one here and one over here, to keep him into a sternal position. Head down, come on. Head down, like this. So that's gonna prop his head up a bit. And he's gonna roll over for me now. But the point of that is so that way it keeps the position of the dog. It's very common in barrel-chested dogs that they're not able to actually stay in a sternal position. So what we need to do is we need to prop them up so that way they're not able to roll over onto their sides. We do that a lot in surgery too, so that way they don't end up falling over, and we can actually keep them in the same position, especially with if we're doing an abdominal type of surgery. And why you wouldn't want the patient to stay in one position longer than 4 to 6 hours. It's really important that the patient doesn't stay in one position longer than 4 to 6 hours because what can happen is muscle atrophy and muscle loss, and it can really make it more difficult once the patient is no longer sedated and is able to walk around on their own again, and they're able to leave the hospital to go through the recovery. So it's really important that we are doing these motions for the patients, and I'm showing them the natural motions, so that way we are, like we did with the PROMs video of the limbs. If we're doing that, then what can happen is that the chondrocytes don't lose as much of their lubrication, and we're actually getting more of a natural movement through the joints, so we are not going to have as much of a loss of muscle because you're lubricating the chondrocytes. So what happens is we're actually able to get more of a natural movement of muscle quicker, or movement of joints quicker, and after we end up coming out of the hospital and out of the surgery, out of the sedation. So the patient's able to move around by themselves more quickly. It's especially important for sure when the area is involving the hips, or the area is involving the back, or involving the neck. There's lots of joints and cartilage in those areas that need to be manipulated and need to be taken care of, otherwise it can take longer to be able to recover from the surgery. Yes, definitely important, the thoracic region there as well. I'm reading that. And if we needed to pad the elbows and the chest, can you lie down? Lie down, buddy, lie down. So if we had to pad the elbows and the chest, we could take smaller blankets and we could put them under a patient. Come on, Hunter, up. Kind of like this. Hunter, come on up. And that will provide some padding for our patient. Okay, I think I explained all of this.